So the question is, can intracranial hypertension fluctuate to where it is missed in diagnosis? Yeah, that happens all the time. So you want to make sure that if that's something you think you have going on, we want to choose tests that are more sensitive to chronic changes in hypertension. So these would be, number one, looking at an OCT, an ocular CT, to see if we're having swelling of the retinal fibers. You can also get a lumbar puncture. It's a little more invasive and it can be tougher. Sometimes they cause their own problems, but you'll get a clearer view from those. The second thing to think about though is if you're having fluctuating hypertension, then there's a high probability that you're having changes in the ability to drain fluid from your head. So if that's changing over time, what we may want to then look at is there something that's blocking the outflow from your brain? And usually the primary culprit will be something like the internal jugular vein. We get restriction somewhere in the neck and that causes a buildup back into the head and that can cause those symptoms. In that case, you may want to look at something that's looking at the vasculature in imaging. So that could be a CT angiography venograph, or it could be an MR angio or venograph. And in those instances, we can see if there's a structural component in the neck or in the head that's causing a backup of that fluid into the head. So hope that helps.